not be getting a hot pizza or an online order dropped off at your door by drones anytime soon, but an unmanned aerial vehicle delivery could save your life in the future. As ABC 2 News' Catherine Hawley found out, drone research is being done right here in Baltimore that could transform healthcare.
They zip around at nearly 100 miles per hour. It takes fast reflexes and a need for speed to race drones. Over at Johns Hopkins, they're working at a slower pace. For the last 4 years, researchers have been field testing drones to move medical samples.
We knew that these samples are sensitive, and we wanted to figure out what things do we need to bring to the drone to help make medical transportation viable.
The experiments focus on if those bumpy flights and temperature changes in the air hurt cells and impact biological samples. A difference of just 2 degrees or a few hours can make specimens unsuitable for lab tests and blood bad for transfusions. The team had to modify and customize the drone before the studies even started, transforming it from a high-flying camera rig to a medical ferry.
We developed a refrigerated compartment. That is a compartment that's lightly insulated to save weight, but it attaches to the aircraft's power supply and uses that power to run a very small refrigerator that keeps the specimens at a controlled temperature that is set and monitored by a computer on board.
In the most recent tests, the samples were flown around for up to 40 minutes, covering a distance of about 12 miles, then packed up and taken back to the lab to be examined.
And in those studies, we found no impact, which is great, right? So basically, the samples arrived fine, which is what we would need if we're going to use drones as a way to move these samples.
Using unmanned aerial vehicles instead of cars for medical transportation could revolutionize healthcare by getting critical blood supplies to rural, hard-to-reach places quicker, delivering life-saving pints of blood to the scenes of accidents and natural disasters, and speeding diagnosis and saving lives in poor countries. But Amukule thinks the technology could really take off by providing a faster and cheaper option to move specimens between medical facilities.
If we had 2 hospitals here in Baltimore City that were separated by 5 miles, for example, we know that that distance can be covered by a drone in, say, 10 minutes. In a car, it would probably take half an hour.
Saving time and money getting across town in heavy traffic. Eventually, Amukule envisions a drone network connecting area hospitals and labs. Questions still remain about the logistics and capabilities of using drones this way, as well as navigating FAA regulations. The team at Johns Hopkins says they plan to continue running more tests to bring medical drones closer to reality. Catherine Hawley, ABC 2 News.
Now, Catherine tells us that the drones are already being used to move medical supplies, but not quite widespread yet. San Francisco-based company Zipline is working with the government in Rwanda to parachute blood products to remote areas from drones. And trials are underway in Switzerland, testing autonomous flights transporting lab samples between 2 hospitals. A handful of other groups are also exploring this area.